Depression. Signs, symptoms, and how to identify. Learn to recognize the signs and symptoms of depression and how to seek professional help. Have you ever felt trapped in a bottomless pit of sadness and despair? Days that once seemed full of colors turn gray, and activities that used to bring you joy lose their meaning. Can you relate? These may be signs of depression, a mental disorder that affects millions of people around the world. But how do you know if it's just a rough patch or something more serious? In this article, I'll help you recognize the signs and symptoms of depression, as well as teach you how to identify it. Understanding depression. Depression is much more than simply feeling sad on a bad day. It is a serious clinical condition that impacts a person's mood, thinking, and behavior. It can interfere with work, relationships, and the ability to carry out daily activities. Imagine your mind as a beautiful flower garden. With depression, this garden gradually becomes gloomy. The flowers lose their vibrancy, and the joy disappears. It's a disease that requires attention and proper treatment. Signs and symptoms of depression. Depression can manifest in different ways, and symptoms may vary from person to person. However, some common signs include mood changes, profound and persistent sadness, feelings of emptiness or distress, frequent irritability and moodiness, loss of interest or pleasure in once enjoyable activities, feelings of guilt, worthlessness, or hopelessness, recurring thoughts of death or suicide, sleep and appetite changes, insomnia, difficulty sleeping, or excessive sleep, difficulty waking up in the morning, even after seemingly good sleep, loss of appetite or uncontrollable hunger, drastic weight changes without medical explanation, physical and cognitive changes, constant fatigue and lack of energy for simple tasks, body aches without apparent cause, difficulty concentrating, remembering, and making decisions, psychomotor agitation or retardation, slow movements or restlessness, decreased libido, sexual desire. Recognizing these signs and symptoms is crucial for identifying depression and seeking appropriate treatment. Risk factors for depression. There are various factors that can contribute to the development of depression, including genetics. Individuals with a family history of depression are at higher risk. Stressful life events, the death of a loved one, divorce, job loss, or financial problems can trigger depressive episodes. Chronic illnesses, diabetes, cancer, and other chronic diseases can increase the risk of depression. Substance abuse, alcohol and drugs can exacerbate depression symptoms. Hormonal changes, women are more prone to depression, especially during pregnancy, postpartum, and menopause. How to identify depression? If you notice the presence of several of these signs and symptoms for at least 2 weeks, it is important to seek professional help. A psychiatrist or psychologist can conduct a comprehensive evaluation to diagnose depression and determine the best treatment. Do not ignore these signs. Depression is a treatable illness, and the earlier it is identified, the better the prognosis. Distinguishing depression from sadness. It is important to differentiate depression from passing sadness. We all experience sadness at certain times in life, such as mourning the loss of a loved one or the end of a relationship. But sadness is typically transient and does not significantly interfere with daily routines. Depression, on the other hand, is a persistent condition that affects various aspects of life. The symptoms are more intense and last for a longer period. Consequences of depression. Untreated depression can lead to various complications, such as social isolation, work or school problems, anxiety and panic attacks, substance abuse, physical health problems, self-harm,
Suicide.
Treatment options for depression. The good news is that depression is highly treatable. There are various therapeutic options available, and the best treatment plan will be individually tailored by the physician, considering the severity of symptoms and the patient's history. The main approaches include therapy, an effective therapy that teaches the patient to identify and modify negative thoughts and behavior patterns that contribute to depression. Through specific techniques, such as cognitive restructuring and systematic desensitization, the patient develops tools to cope with life's challenges more healthily. Medication. Antidepressants can be used to regulate the functioning of neurotransmitters in the brain, such as serotonin and norepinephrine, aiding in the control of depression symptoms. There are different types of antidepressants, and the doctor will choose the most suitable one for each case. It is important to follow medical guidelines regarding dosage and treatment duration. Lifestyle changes. Adopting healthy habits such as regular physical exercise, balanced nutrition, adequate sleep, and cultivating good social relationships significantly contributes to the treatment of depression. Mindfulness and relaxation techniques. Meditation and deep breathing techniques can help reduce stress and anxiety, common symptoms of depression. Seeking professional help. If you suspect that you or someone you know may be suffering from depression, do not hesitate to seek professional help. There are various services available, such as community psychosocial care centers, public units that offer free assistance with psychiatrists, psychologists, and social workers. Hospitals and private clinics provide care with professionals specialized in treating depression. Health insurance plans. Most health insurance plans cover consultations with psychiatrists and psychologists. Support helplines. There are free telephone lines that offer emotional support and guidance on how to seek help for depression. Depression is a serious mental disorder, but it is not a life sentence. By recognizing the signs and symptoms, seeking professional help, and following the appropriate treatment, it is possible to overcome depression and live a fulfilling and happy life. Do not be afraid to ask for help. There are qualified professionals ready to assist you on this journey of overcoming. Take care of your mental health, as it is essential for your overall well-being. Now you have a broader understanding of depression. Remember, the information contained in this audio does not replace professional diagnosis and treatment. If you need help, do not hesitate to seek a doctor or psychologist. Frequently asked questions. Question 1. Is it normal to feel depressed from time to time? Yes, it is normal to feel sad or discouraged occasionally. However, if these feelings persist for weeks and interfere with your routine, it may be a sign of depression. Question 2. Is depression curable? Depression does not have a definitive cure, but it is a highly treatable illness. With proper treatment, most people can control symptoms and lead a normal life. Question 3. Can I treat depression on my own? While adopting healthy habits is important, depression requires professional monitoring. A psychiatrist or psychologist can provide you with the tools and support needed to overcome the illness. Question 4. Are there medications for depression? Yes, antidepressants are effective medications for treating depression. However, medication needs to be prescribed by a doctor and should be used in conjunction with other forms of treatment. Question 5. How can I help someone who is depressed? Offer emotional support, encourage the person to seek professional help, and assist them in adopting healthy habits. Be patient and understanding, as depression can make social interactions challenging. We have reached the end of the audio depression, signs, symptoms, and how to identify. Did you like this content? Share with someone who needs support right now